Hello, this is Smita Kumar, and you're watching MediCircle. Today, we have another healthcare startup, and we'll be talking about how that particular startup is innovating the way healthcare is consumed. So, hi, we have Pooja Gupta with us. She's the co founder of PurpleDocs, and she will be telling us more about the innovations, especially what they have brought into prescriptions and other things, because a lot of time the digitalization of healthcare is hampered because doctors are, I mean, it seems very difficult for them to maintain eye-to-eye contact also and write a prescription also. So that has been a problem all so many years. Let's find it out from Pooja how they are solving this particular problem. So hi Pooja, welcome to MediCircle.
Hi, thank you for having us. Thank you for inviting me. It's a pleasure to be speaking on this forum.
So same here, Pooja, and let the audience know like how PurpleDocs was started and what exact problem it is solving.
Okay, so I think PurpleDocs is one of the oldest in this domain. We launched PurpleDocs back in 2011. I would say it was the pre-WhatsApp era where even the doctors that we targeted, they did not even have laptops in their hospital. I remember doctors did not even have email IDs back then. And at that time, we faced this issue on a personal front, wherein Deepak's mother, my mother-in-law, she was suffering from cancer and she was being treated for a very long period of time, for 3.5 years. And how it happens is like every time she was due for a visit, we'll take a day or two and organize her records and carry 3 bags full of records, even though she was being treated in the very same hospital every time. And in cases of emergencies, one person has to run to go through the documents, and just not the documents, there were CDs, there were scan reports, everything. And for them to be easy. So this question, I remember I had just come back. We had just relocated from US. We wanted to do something in India, but we were still working. So Deepak was working with his company in US, and I had taken a job in Pune, and I used to accompany my mother-in-law for the treatments. And I used to be the person who used to carry those loads of records. And every time there would be a surgery or something, and I would have to furnish a last scan CD, and they would not even know the dates. And then this question cropped up in my head that we engineers, we boast so much about we being the pillars, the IT pillars of other countries, especially US. What are we doing for our own country? Why are we not trying to change the situation over here? So thankfully, we had a foot in the door. We belong to a family of doctors ourselves, and we had good access to the fraternity. We did for 2 years. We talked to multiple hospitals in Pune as well as in Vadodara. We tried to find why the existing solutions, they were not expensive at all. So HMS solutions were very simple. They're still very cheap. Why they do not have a penetration, why they are not used beyond the registration desk. And that's how we found out that solutions are difficult. They are not made with Indian doctors keeping in mind. Over here, unlike US, where a doctor spends 30 minutes per patient, over here it is 2 minutes or 3 minutes per patient. In that amount of time, and he's got a huge queue, his staff has to be uh, more aware of how to treat the patient rather than being a tech savvy.
True.
Plus, tech savvy staff, even till today, it's like a luxury for hospitals, right? It is not their main concern. I would say their main concern is to provide a better healthcare. So somehow that the whole solution, PCs did not have access, internet is still a problem, right? So at that time, we launched a very simple service for them, wherein we said, okay, just outsource your patient record digitization to us and forget it. I remember we had question marks raised. Nobody had even heard about it. So for 6 months, Deepak said, okay, forget about the price. Give me 1 record, 2 record, 10 record, whatever you want, and I will give you a search engine in which you'll just put up the patient name and you'll get the digitized copy. And that's how we educated the doctors in Baroda. And we were lucky enough, within a span of 12 months, We were serving more than 20 hospitals in Vadodara.
Oh, wow. That's great.
And the only marketing we did at that time was the word of mouth. Our customers are so pleased with us that even today, for every new IT requirement, Purple Docs is what they approach to.
Okay.
And that is how we have been. So from IP, so I think we are the only players in the country who have organized the whole IPD digitization even till today date. No other players are there, organized players are there. There are scan houses, there are local scan vendors who do it for the hospital, but we have a service wherein we create a search engine for doctors wherein they put absolutely customizable service. If they want diagnosis to be tagged, if they want doctor's name to be tagged, and they can do complete analytics. So whenever a patient comes in, they have to just put the patient name and the whole history just pops up in front of them.
Okay. Okay.
And from there, the organic growth started, and we ventured into OPD, we ventured into PHR and everything else.
So what is like the USP, the unique value propositions that PurpleDocs is offering over other e-prescription platforms like we have DocSpur, we have HealthFlix?
Okay. Speaking specifically of the e-prescription or other products within our brand, we have like 4-5 products. Our USP has always been the UX plus the ability to customize. So all my services are absolutely customizable by the doctors because we understand that they need an absolutely easy interface. They have their own forms. There's no standardization. A pediatrician sitting in Delhi will have his own type of fields. He will enter his own kind of data, and pediatrician sitting in Mumbai will capture something else. So we have the ability to design on the fly an interface that they need. And our USP has always been to reduce the amount of work. We don't increase the workload. So if you will see the counterparts in America, physician burnout is a massive problem because see, something is there on the left menu, something is there on the right menu, something is on the top menu. Doctors can't, they have to treat the patient rather than search for the apt menu. So what we do is we say, okay, whatever you want to see, just tell us that, and it'll be coming in your sequence. That's it. There is zero learning curve. That is what we have. So the other counterparts that you're talking about, for example, DocSpur, that's a different solution altogether. It is a hardware-based solution where you have a pen, but you have to write. Our USP has been we reduce the effort. So we enable them to make templates. We enable them to, if the patient is coming up for a follow-up, doctor doesn't have to write the same set of medicine. He can just tick the last prescription. It is there. He can create templates. For example, a COVID template. COVID medicines will be prescribed. So we want them to talk to the patient more and spend time looking at the tab less and still be able to have a compliant prescription delivered. And that is why I think we have got one of the highest stickability. Our doctors who are using our EMR, they are generating on an average 10,000 prescription per month, and they just cannot live without it.
That's great.
Because the solution is designed by them.
So definitely, like healthcare is so volatile, and again, there is an absence of true standardization is not there. So definitely,
Yes.
scope of customization is there, and I think definitely those startups would win the game who are offering a very customized kind of a solution, not to just the doctors, hospital providers, everyone who can actually brand it as per their own logic and policies. Moving on to my next question, like how many clients you have benefited because you have been offering these solutions since a long time.
Yes. So using all our products since 2011, we have a whopping 95 lakh plus health records on our platform till date.
Good.
We have served more than 150 hospitals. Our solutions are being used by more than 500 doctors today.
That's great. And how, like, you have also received 2.7 crores of funding in its angel round from Kelly Gamma Funds and also from Lead Angels. So, how has the funds been utilized, and what are the next plans, especially in funding?
Yeah, so when we raised the funding back in 2015, we had only one product line and we were only operating in Vadodara. So we used the fund to expand our footprint. We expanded to 16 cities, including Delhi, Bangalore. We launched 3 more products since then, and we are still growing in terms of our product offering.
That's good to know. So, like, how were like your revenues, especially in FY 2022, and what you're planning to close at FY 2023?
Yeah, so I would divide that whole thing into two phases. There was a pre-COVID phase and there is a post-COVID phase. So
But
pre-COVID,
how
we
COVID
were
has affected? Has it accelerated the sales?
no, no, no. I think it has hit the medical fraternity the hardest, I would say, because there were only one kind of patient. There were only COVID patients. Everything else took a step back. Patients were not moving out of their house.
Yeah.
So it has really hit the market badly. And plus, we also could not jeopardize the health conditions of our own people. So our services did get affected for sure. Pre-COVID, we were growing on year-on-year basis, up to 100% growth we were showing. Post COVID, we used the time in COVID to develop new products and offering. So our footprint has increased, and now we are kind of back on track. And we are again this year we are targeting 100% growth.
That's great. So, and like, how are your goals and future expansion plans as you're already there in so many cities in India? So, anything specific you're targeting to scale it up and to the go to the market thing? Because in South also digitalization is there. So, what kind of territories and areas you are planning to scale up?
So we are targeting both horizontal and longitudinal growth. So as far as the EMR product has come, it has completely stabilized. So we're expanding the markets. We are exploring Mumbai and Delhi and Noida with that. And along with that, we are also coming up with the B2C product, which will bridge the gap between the doctors and the patients. And that we're about to launch within a month or so. You just wait for the news.
Great. So, like, this would be something for the doctors and the patients to interact on.
That is true. That is true. So it'll be bridging the gap. It'll make the patients book the appointments more seamlessly, uh, provide leads to the hospitals, and it. So the benefit has to come to the patient somehow, right?
Yeah.
The digitization is still not benefiting the patients. So we are making a platform using which the patient can come and see their own history and see their own records. And thankfully, NDHM has become a big player into that because of the NDHM, every startup which was working in silo, there is hope that we all will unite and eventually help the patient.
Definitely. So, any piece of advice for budding entrepreneurs, especially you want to do something in health tech?
It is a difficult, I would say, market, unlike other markets which are driven by demand. You have to create demand. So be very careful. You have to relate to the need. You have to study the market. Things may look very lucrative from outside. I would say everybody who wants to be an entrepreneur should at least work for a startup, because this journey is not that smooth. It needs a lot of perseverance, a lot of hard work, commitment, and a zeal. Because most of the places when it's driven by demand, things are the journey becomes much more easier. Over here, as you rightly said when in the introduction, the doctors are the trickier ones, because their main aim is to provide the best of the health services. Digitization takes a back step. So if you are entering health tech as specific to that, you have to be extremely, you have to relate to the problem, and you have to do your research. So there are a lot of people who would say, because doctors can't visualize stuff, unfortunately, they're not that tech savvy, right? So for them, they would nod their heads, yes, I would need something like that. But when you present the solution, they may not adapt to it. Adaptability is the question. Yeah.
Very
So you
true.
have to do your POC, you have to do your groundwork, you have to do your research, and then enter this field.
True, but like as our an IBF report, like as healthcare market is definitely expanding in leaps and bounds. It is going to reach $372 billion by the end of 2022. And in that, how is this prescription market taking place? So the global e-prescribing market size is projected to reach USD 3.3 billion. That is $3.3 billion by 2025 from $1.2 billion USD in 2020. Definitely, it's a big jump. And Prime Minister Narendra Modi has also announced the launch of the Ayushman Bharat Digital Mission, which is actually facilitating so many startups to make healthcare more digital, more accessible to the end users, that is the patients. And he also asserts as the potential to make a revolutionary shift in India's healthcare facilities. But when we talk about actually e-prescriptions and other things like that, we need to definitely consider the absemal ratio, which is like Indian, I mean, when we are talking about India, the doctor's patient ratio, as per my latest stats, it is 1 is to 834. That means one doctor for 834 patients. So definitely we cannot have that kind of a Western country mindset when we are proposing our products, because here the doctors are lesser and there are so many huge patients. So we definitely need to digitalize the e-prescription market in such a way that we are trying to actually, the doctors are trying to see more and more patients at the same time, and also making the prescriptions digitalized so that the analytics can be done and other things can be done. I think Purple Doc is also doing a great job in this particular domain. And I wish Pooja and Deepak all the best for all your future endeavors. And thank you so much for joining us today at Medicircle.
Thank you so much. It was a pleasure to be speaking to you. Thank you.
Most welcome.